The paucity of the effective salvage regimens in the relapsed refractory acute myeloid leukemia, with the different salvage chemotherapy regimens showing fairly similar efficacy and not substantial increase in overall survival. In this particular study, we used the propensity score matching analysis comparing retrospectively patients who received at our institution 10-day decitabine with the Venetoclax regimen in the clinical trial setting in the relapsed refractory AML, and those who have received intensive chemotherapy on one of the clinical trials, again, performed in the same institutions. We match patients based on the ELN risk, age, and the prior number of therapies, and have come up with approximately 55 patients in each cohort that we were able to compare. The results have shown that the combination of Decitabine and Venetoclax was in fact more active compared to the historical chemotherapy alone cohorts, with lower rates of refractory disease of 39% compared to the 69% in the intensive chemotherapy arms. It was also showing improved event-free survival with the p-value significant in the stratified t-test of 5.7 compared to 1.7 months, although the overall survival trended but did not appear to be superior of about 7.1 compared to 5.5 months. Most importantly, this combination was safer overall than intensive chemotherapy, with early 30-day mortality of only about 7% compared to 9% with chemotherapy only, but lower rates of grade 3-4 adverse events of 69 compared to 89%. Based on this, again, retrospective analysis, we propose that the Decitabine 10 days Venetoclax combination would be an effective salvage chemotherapy regimen and potentially can serve as a bridge to the allogeneic stem cell transplantation in the relapsed refractory AML, which could be used along with other intensive chemotherapy options and perhaps is safer and more efficacious, at least in the subset of AML patients.